Hi, I'm a first year medical student studying at my top choice university in the UK, and today I'm going to share how you can also do the same. The journey of getting into medical school arguably begins in year 11, specifically with your GCSEs. The individual GCSE requirements for each medical school do vary, so always check the website of any university you're interested in applying to, and also have a look at other resources like the Medical Schools Council Guide. I personally also found websites like the UCAT People and MedicMind really helpful, especially since they had profiles of each university where they broke down all the requirements and put it in a table format, as well as including lots of information on things like the structure of the course and the teaching style. Having said that, don't forget that a university's official website is always the most accurate and best source of information, so do adhere closely to that. As a general rule of thumb when it comes to your GCSEs, however, is choosing triple science if you can and achieving high grades ranging from grade 7 to 9. And this will put you in a strong position for when you apply later on. The better that you do in your GCSEs, the easier you'll make it for yourself when it comes to applying, because it gives you a competitive advantage and takes a lot of the stress and pressure off. In terms of A-levels, most universities ask for chemistry and biology. I know a lot of people say you don't strictly need to have biology as a subject in the same way that you need chemistry, but in all honesty, you'll limit your options quite a lot if you choose only chemistry. So I'd advise to choose both chemistry and biology. And in terms of the third subject, it really is up to you. Most students pick maths as the third subject, but it's not a requirement. I didn't pick maths, and I know lots of people who did various subjects, including humanities, as a third subject. And I know some people have this idea in their head that if they take a fourth A-level subject, it's somehow going to give them a massive advantage. But the truth is most universities don't really value this, and it isn't asked of you by any means. So unless you really want to do a fourth subject and you're passionate about it, you don't need to begrudgingly just pick a fourth A-level because of this misconception that it's a requirement or that you need to do it. So moving on from GCSEs and A-levels, in year 12 you also have to sit an entrance exam or an admissions test known as the UCAT, which stands for the University Clinical Aptitude Test. And there also used to be the BMAT, but that no longer exists, and it's just the UCAT now at the moment. And you sit the UCAT in the summer of year 12, and then you will apply to your 4 chosen universities with this UCAT score, along with the rest of your application, which we'll come to later. And you will apply by the end of October, by the October of year 13, sorry. And you can only sit the UCAT once in one academic year, and it's only one part of the application, but it actually has a very heavy weighting. And each university will use the UCAT differently. Some will place more weight on it and less others so, but generally speaking, it can and it is heavily used as a tool for differentiating which applicants should be interviewed and which ones shouldn't. So definitely make sure you prepare well for this exam and that you give yourself enough time to understand what it's about and to get to grips with each of the sections and what they assess. If you want a more in-depth explanation of the exam on tips, on how to approach different questions and sections, I'll leave a link to some helpful articles in the description. Apart from the academic aspect, you also need to bulk up your extracurricular portfolio. 2 aspects of this are pretty much expected, and they are work experience and volunteering, and it's expected that you do these. And the rest of the extracurriculars that you decide to pursue are up to you and dependent on what your passion and interest lies in. But going back to work experience and volunteering, it's really important that you understand the difference between them. So work experience tends to be more short term, and it can typically last a week or sometimes more as well. And it tends to be either within a GP practice or in a hospital, and it involves shadowing doctors to begin with, but also lots of different members of the multidisciplinary team if you get the opportunity. So individuals like nurses, occupational therapists, physiotherapists, radiographers, and more. It's really important to get that variety so you can appreciate the different roles and understand how they work together and how they are sort of dependent on each other in order to give the best possible treatment to the patient. When you're doing your work experience, one of, if not the most important things, is to reflect, and you'll hear this time and time again. Reflect on what you've seen and why it's significant, and try to make that link between what makes a good doctor on paper and how you're seeing that in action in real life. After COVID, there's also been a lot of virtual work experience which has become available. And I would say if you can, do try and take part in a few of those virtual work experience opportunities early on when you have more time so that you can get it under your belt. But really do try and prioritise getting the in-person work experience, especially at the hospital, because it's just so valuable and there's no comparison in terms of the things that you can pick up and learn. And it's really in the hospital that you get to see the multidisciplinary team in action, to the full extent. And also you learn, I think, you see a lot more of the ethical issues in greater depth. So for example, I was on the geriatric ward and I learned a lot of things. So I came across things like DNA CPR, so do not attempt CPR. I saw things like, when it came to consent and capacity, because there were a lot of patients that lacked capacity, for example, patients who had dementia. I learned about things like lasting powers of attorney, IMCAs, which are independent mental capacity advocates, and lots of other ethical scenarios and situations which really helped to deepen my understanding. And it was just really invaluable, that experience that I got. Now, volunteering is different to work experience in that it's more long term and it can last anywhere from months to years. And it's typically more focused on the soft skills like empathy, kindness, resilience, and dedication. Whereas work experience is a mixture of those soft skills as well as the science and the medicine as well. And with volunteering, it's about giving up your time and giving it to a good cause. So there's no wrong or right place to volunteer at. In fact, the more personal the cause is to you, the better. And generally, common examples of where people might volunteer include care homes, schools, charity shops, and soup kitchens. But like I mentioned, it might be something that's personal to you. So if you, for example, pets and animals are very close to your heart and you want to volunteer at an animal rescue shelter, then definitely that's something that you should consider and something that you should do, because it means that you'll be able to talk about it and speak about it with more passion because it's something that you genuinely care about. Now, moving on to the rest of the extracurriculars, you want to do as much as you can to strengthen your application and yourself as a candidate, whether that's Duke of Edinburgh, an EPQ, biology or chemistry Olympiads, competing in sports, entering essay competitions. It really just depends on where your strengths lie, what you enjoy doing, and what you would be comfortable and able to confidently discuss in your personal statement and, of course, interview later on. Which brings me to my next point, and that is the personal statement, which you submit in October with the rest of your application. And this is really just your opportunity to show off all your skills and why the university should invite you for an interview. You do have a limited number of characters, so be very selective and intentional with what you share, and focus on having a clear, well set out structure. And one type of structure that does work really well is a cyclical structure, which is essentially where you begin with a certain theme or idea and you return back to that at the end, which can be a really nice sort of way to set out the personal statement. And again, like I said, the characters are limited, so it's best not to sort of start talking about your A level. So like, I'm studying chemistry, I'm studying biology and things like that, because the admissions officers will see that from your application, from your predicted grades and things like that. So the information that's already there, or if your referee has mentioned something in your reference, which again is another part of the application, try not to repeat those things so there's no overlap, and really maximise on every sort of character and letter that you've got. Now, once your application is sent off, unfortunately, it is a waiting game until you're invited for interview. And even before you get an interview, it's a good idea to start preparing yourself, because sometimes you will get very short notice. You might only get a week and a half. So it's a good idea to start preparing early, because you don't want to be in a position where you're caught out and you're unprepared. And it's difficult and it's sometimes demotivated getting ready for an interview that you haven't got yet, but do push through it, because your future self will thank you. Now, the preparation process itself is quite long because there is so much information, but I personally enjoyed it. I found it very interesting, and actually there was a lot of times when I went and researched something more and more in depth, because I was really enjoying that process. And if you want to know more on how to prepare, I've got so much on my website, and I'll leave the link in the description below. Now, once your interviews are over, you have to wait again to this time receive your offers, and the offers are dependent on the university. So different universities will have different offers, and again, it changes from person to person. And whatever your offer is, you have to achieve that as a minimum at A level. So for example, if you get an offer of 3 A's, AAA, that's the least that you need to get in your A levels. If you get more than that, that's great, but as a minimum, you would have to get 3 A's. I hope that you found this video helpful, and good luck.